All right, this is Julian from Focus Physical Therapy, and really quick, we're going to talk about three little tricks that you can use to treat your SI joint at home if you're having a little problem. So the SI joint, first, if you look at this, is pelvis, has three bones. You've got this one, and then you've got the triangle tailbone area in there. So the joints here and here would be your SI joint, your sacroiliac joint. And then in the front, you've got your pubic bone or pubic symphysis, and that would make up the third joint of your pelvis. And a lot of times, people, pregnant women, people that are stepping off of things routinely with the same side, they'll develop a little bit of pain back here. You might say, oh, it's really hurting right here, kind of in that dimple area. When you do that, it might be an SI joint. There's special tests that if you're here, we can test for you, but at home, we might not be able to do that on your own. But I'm going to show you three things that you can do to kind of help treat that, to see if we can take some of your pain away. All right, so here's the first thing you can do to help that SI joint. You can treat this way. You're going to lay down flat on your back, and you're going to bring one leg up. This would be if this side's rotated. I know you won't know that one, but you can try this at home. And you can put your hands behind your knee and push away. So you're going to do a little bit of an isometric pushing that way. So you're not pulling your knee to your chest, you're actually just holding it and pushing away from it. You're going to hold it for 5 seconds, and you're going to repeat it 3 times. You're going to do that. So this one here in particular would be if this is rotated back, forward, and you want to rotate it back. So a second one, this one's a little bit more effort. You bring your legs up like you're in a tabletop position here, and you're going to hold behind one, and you're going to push on the front of the other. So you're going to kind of give yourself a little isometric on both sides. Same thing, you're going to hold it for about 5 seconds there, and you'll repeat it 3 times. And you can do it on both sides. When you do it on both sides, it's not going to be exactly specific to what might be causing yours, but it'll be a way that you can kind of hopefully take a little bit of the pain away from what's going on. To do that one, you could also use a dowel. If you have a broom, mop or something, put it over here, and then give yourself that same resistance. This knee would be pushing back in this case. This one would be pushing away. Hold it for 5 seconds and repeat it 3 times on there. So that's the second way. The third way that you can do, and here's something I forgot to mention after the first one, is after you do one of these, you want to make sure and you kind of reset that pubic bone. So you can put a ball, squeeze a ball just a little bit there. If you don't have a ball, that's perfectly fine. You can take your hands and just squeeze a little bit. When you do that, you might feel a little click or a pop in that pubic bone area, which is okay. That's it kind of resetting itself a little bit. Sometimes it'll pop more than once. Most of the time it's just once. There shouldn't be pain with it. It should be easy. So this last one is a little bit trickier, and this is more for if there's what we call an in flare or an out flare, where the pelvis is rotated in or out. And what you would do is you would bring your leg up and you would rotate it out this way, put some pressure on the outside of your leg, and push out. So you're kind of pushing out in that direction right there. Same thing, you're going to do the 5 seconds, repeat it 3 times. The opposite one would be what we call a lot of times like a piriformis stretch. You're going to put pressure on the inside, so you're going to rotate your leg in, you're going to put pressure on the inside of your hand, and then you're going to push that towards your opposite shoulder right there. Same thing, finish up with a little squeeze in that area right there. So those are 3 little ways that you can treat an SI joint problem. These are not specific, to your pain. Might be a little bit different. Might be more on the right, might be more on the left. It could be because one side is rotated forward or rotated back. Could be that it's rotated out or rotated in. To be more specific, if you want some information about how you're doing, then comment below, call us, shoot us an email, and we'd be happy to kind of be a little more specific for your situation. Thank you.